Happy National Preparedness Month, and welcome to our webinar on the role of school public health officials in school safety efforts, which includes security, emergency management, and preparedness activities. This event is a part of the REMS-TA Center's role-based webinar series, through which we have been exploring the various roles within schools and school districts, as well as their community partners, and how they can contribute to a safe and supportive learning environment all year round. My name is Janelle Hughes, and I serve as the project director here at the REMS-TA Center. As with all of our webinars in this series and beyond, there are a few tips for engaging with the platform and with us throughout the event. We have placed some relevant links to online resources via the web link pod. Please explore those web pages and feel free to share them with your colleagues as well. You are welcome to pose any questions in the Q&A pod or communicate any technical difficulties that you may experience today. We will be taking time to answer questions following the presentation and as time permits. After the live event, please do not hesitate to send any questions to the REMS-TA Center via our help desk at info@remstacenter.org. This webinar is being recorded and will be made available in archived form on our site within 7 business days following today's event. So excited to introduce today's guest speaker, Dr. Lisa Berrios. She is a senior advisor for school preparedness in the U.S. Centers for Disease and Control and Prevention's Division of Adolescent and School Health. She leads school-focused activities on CDC's 2022 multinational monkeypox response, following 2 years during the same and on CDC's COVID-19 emergency response. Dr. Berrios has focused on school health at CDC for the past 25 years, much of which was as the chief of the Research Application and Evaluation branch. We are so happy to have her expertise today. Let's take a look at the agenda. We will first provide an overview of the importance of community partnerships and collaborative planning as schools work to develop emergency operations plans. Then Dr. Berrios will help us take a closer look at the role of public health officials as community partners in school safety. The REMS-TA Center will then continue the discussion on how those officials can help enhance the 6-step planning process that is outlined in the Guide for Developing High-Quality School EOPs. And then we'll work into our Q&A session. So again, if you have any questions, please do not hesitate to send them to us via the Q&A. We will close with a few key resources to support your work. Again, do not hesitate to download those resources that you see available now via the web link pod. We will now take a moment to segue into our first poll of the day. We always want to get a sense of whether you've heard of the REMS-TA Center before today's session, and if so, in what context. Perhaps you have attended a live training or virtual training, or you've requested technical assistance, downloaded a resource, met us at a national conference, which we always enjoy, or perhaps in some other way. So it looks like many of you have attended a virtual training or webinar, such as this one, which is always exciting to have new friends joining us. And I also see that many of you have attended live trainings, downloaded technical assistance, downloaded resources, and requested technical assistance. If you selected the other option, do not hesitate to just send us a note via the Q&A so that we can get a sense of how you are familiar with the REMS-TA Center. And thank you again for joining today's event, and we hope that you gained something. Thank you so much. So if this is your first time meeting us, welcome. The U.S. Department of Education's Office of Safe and Supportive Schools administers the REMS-TA Center to help build the preparedness capacity, which includes prevention, protection, mitigation, response, and recovery efforts of schools, school districts, and institutions of higher education with their community partners at the local, state, and federal levels. Our staff members are available via email or phone to respond to your requests for technical assistance on those emergency operations plan development topics. So don't forget that we're always here for you. Families and communities expect schools and school districts to help children and youth to keep them safe from threats, including crime and violence, as well as hazards like natural disasters, disease outbreaks, and hazardous materials spills. In collaboration with their community partners, schools and school districts can plan for these potential threats and hazards through the creation of a school EOP, which describes how people, not just students, but also teachers, administrators, staff, and visitors, as well as property, will be protected on and off campus. The EOP will also detail who is responsible for carrying out specific actions before, during, and after an emergency. It will also identify personnel, equipment, facilities, supplies, and other resources available, and of course, outline how all actions will be coordinated. While school EOPs vary in their content from state to state and locality to locality, and as they are customized according to the school building, they generally contain 3 sections. The basic plan, which provides an overview of the school's approach to emergency operations, such as training and exercises, as well as information collection. The functional annexes section presents how the school will manage some of those common essential functions, such as evacuation, communication, accounting for all people, etc., before, during, and after an emergency. And then the threat and hazard specific annexes section will identify protocols that schools will follow to address specific types of threats and hazards that become emergencies, such as hurricanes, wildfires, active shooter situations, food contamination, power outages, and of course, much more. School EOPs should be developed by school-level emergency planning and response teams with membership from the district's core planning team. And the formation of this multidisciplinary planning team is step 1 of the 6-step planning process that is outlined within that guide for developing high-quality school EOPs. And that, as well as its companion, the role of districts in developing high-quality school EOPs, are both available via our web link. These guides may be used by core planning teams to create new plans, as well as to revise and update existing plans. And we'll walk through step 1 as well as the additional steps a little bit later on during today's webinar. So why collaborate? Because the planning and development of a school EOP require the expertise of a diverse group of people so that it reflects the diverse needs of the school community. Everyone has expertise to contribute from within the school community: administrators, transportation directors, teachers, school facilities managers, IT specialists, school psychologists, families and parents, school nutrition directors, and of course, public health officials as well. Community partners or representatives from the local community outside the school also play an important role in school safety. Members of the community are often the first on the scene as school emergencies occur to provide volunteer support and donations, and they are often the ones education agencies call on to serve key roles in response and recovery. Community partners not only have expertise in emergency management planning topics, they also have invested interest in the safety and well-being of students, staff, families, and caregivers. Furthermore, their collaboration will help ensure that the school EOP is integrated with local and regional EOPs. Community partners for schools to consider collaborating with on EOP development efforts may include fire officials, emergency medical services personnel, law enforcement professionals, mental health and behavioral health practitioners, representatives from youth-serving organizations, and of course, public health officials, which is why we are here today. Community partners can serve on a building-level school core planning team or on the school district core planning team. They may also serve on an ad hoc planning team that supports the school and the district. And it's always good to consider establishing formal agreements, such as memoranda of understanding, with those school districts and those public health official partners. They can really help provide valuable insight as schools and school districts work to respond to particular types of threats and hazards, including infectious disease, contaminated food outbreaks, hazardous materials releases, natural hazards, as well as emergency management functions, including those that you see listed on the screen, and so much more. And we'll hear a little bit more later about some of the other ways that they are able to support education agencies as they work to enhance their preparedness capacity. Now we'd like to check with you again to get some feedback via a poll. We always want to learn as well about the role that you play in school safety, security, emergency management, or preparedness within your school, locality, or state. So please take a moment and respond to the poll, everyone. And it looks like a good majority of you so far support EOP development. So we really hope that you'll find today's webinar, as well as the additional webinars that we offer in this series, helpful. Again, we definitely encourage you to download the resources that we have available via the web links, as well as to check out the REMCA Center's website, as we offer a variety of resources on EOP development. It's also so great to see individuals here supporting training and exercises, and we'll talk a little bit about that as we walk through step 6 in the planning process, which is when you practice the plan in collaboration with community partners such as public health officials. And thank you again to those who are joining and who support incident response and recovery. Again, key areas of support for schools. If you selected other, don't hesitate to share via the Q&A box that area in which you are supporting. We really appreciate you participating in the poll to give us a sense of who is joining us from the field. Again, don't hesitate to pose your questions to us via the Q&A pod throughout today's event. And with that, I will turn things over to Dr. Barrios so that we can take a closer look at the role of public health officials as community partners in school safety.
Thanks so much, Janelle. As everyone's heard, I'm Lisa Barrios, the Senior Advisor for School Preparedness in CDC's Division of Adolescent and School Health, also known as DASH. And I would like to just start by saying thank you to the REMCA Center for inviting me to speak today about the role of public health officials in supporting school safety efforts. Next slide, please. There we go. For more than 20 years, DASH has been involved in CDC responses to emergencies that have impacted schools. These have included roles in everything from the Columbine High School shooting to 9/11, school concerns about mail containing white powder during the anthrax attacks, H1N1, Ebola, and Zika. Typically, recognition of the needs of schools and our involvement in the public health response has been reactive once an emergency or public health crisis is already underway. Next slide, please. Given this experience, we took advantage of the lead time before COVID-19 was declared a public health emergency in the U.S. to get a head start on addressing the needs of schools and developing guidance. But again, all of this work happened on the fly in the midst of a global pandemic. Our work was reactive once the emergency was underway. The DASH recognized that schools need to be better prepared for both short-term emergencies, such as a school shooting or an earthquake, as well as long-term emergencies like an infectious disease pandemic. And CDC needed a way to maintain infrastructure and a focus on school preparedness to be able to ramp up quickly for the next response. So in February 2022, DASH created the School Preparedness Unit to develop an infrastructure to be proactive and prepare internally for school emergencies, while also helping schools, health departments, and states prepare. By focusing on the preparedness needs of schools now, we can be ready to step in and help during the next emergency. And we're not alone in this realization. The scale of the COVID-19 pandemic and the large burden it placed on schools has shown both the public health and education communities the importance of working together to prepare for both short and long-term emergencies. Partnerships between public health agencies and education agencies have existed for decades, particularly in the areas of clinical service delivery, such as testing, screening, referral, and immunization, education and outreach, and in developing comprehensive school-based programs. But faced with the pandemic, many public health officials and schools formed new partnerships or greatly expanded existing ones. Schools needed guidance to understand the impact of COVID-19 in their community, what prevention steps they should be taking, how to conduct contact tracing, and what laws and regulations impacted their ability to put various prevention strategies in place. Many health officials distributed funding, staff, and technical assistance to help schools provide testing for COVID-19 and vaccinations. They also helped schools identify cases of COVID-19 and close contacts to help control the spread of COVID-19. The key now is to use what we've learned and the partnerships that we've formed to prepare for future emergencies more effectively. Next slide, please. So before getting into the details about specific roles of public health, I thought it might help to lay out a few guiding principles for coordination. Schools and health officials have different priorities. Public health officials focus on collecting data on health risks, reducing disease and premature death, improving access to health care, and communicating about health issues. Schools focus on academic success, preparing students for the workforce, and keeping kids safe. This last priority is the main area of overlap where schools and health officials can work together. Both want to keep students and staff safe. During the pandemic, competing priorities sometimes led to difficulties determining which prevention strategies to implement. Virtual learning better met the public health priority of minimizing the spread of disease, but in-person learning aligned better with the educational priority of academic success. Balancing these priorities is important to keep children safe and in school. When collaborating, public health officials and schools should understand their unique roles in keeping students and staff safe. For COVID-19, these roles were typically balanced by health officials providing guidance, data, and technical assistance to schools about cases and prevention strategies, and schools determining which prevention strategies could be implemented to minimize the disruption to learning. With these busy roles and priorities, it's important for schools and health officials to carefully plan involvement. During the recent pandemic, many organizations were surprised by the length of time the emergency lasted and the amount of work it took to conduct contact tracing and testing, convert to virtual learning, and many other aspects of adjusting to pandemic life. Strong preparation can help make the transition and response smoother and minimize the number of extra hours needed from staff to respond. And finally, as many schools and health officials learned during the pandemic, different organizations have their own language and their own sets of acronyms. When working together, we should try to avoid using acronyms to help avoid confusion, while also explaining any jargon and technical terms. For example, many school leaders were unfamiliar with the differences between quarantine and isolation early in the pandemic, which were familiar to public health officials. Alternatively, many public health officials were unfamiliar with the nuances of FERPA, IEPs, and Section 504. Next slide, please. One term that is familiar to both education and public health is an all-hazards approach. Although COVID-19 is the emergency we're all the most familiar with right now, as you well know, it's not the only one that schools and health officials should prepare for. Hazards and emergencies can include anything from bioterrorism to a chemical release, infectious disease outbreak, natural disaster, radiation contamination, or shooting. Public health can be a critical partner with schools to address these and a variety of other crises. Although you might be more familiar with using an all-hazards approach to plan for and address short-term emergencies, many of the action steps to prepare for longer-term events can be very similar. Schools and health officials can work together to prepare for a variety of emergencies that could affect their community, regardless of type or how long it will last. Next slide, please. So let's turn to what this all means for preparedness and working together across public health and education going forward. The national preparedness goal is a secure and resilient nation with the capabilities required across the whole community to prevent, protect against, mitigate, respond to, and recover from the threats and hazards that pose the greatest risk. Next slide. Within the National Preparedness Goal, there are 32 core capabilities across 5 mission areas, Only one of the core capabilities focuses specifically on public health and medical support. So in 2011, CDC established 15 capabilities to help operationalize how state, local, tribal, and territorial public health officials can prepare for, respond to, and recover from emergencies. These capabilities help by providing a comprehensive framework, common terminology, references to help jurisdictions define their preparedness and response role, suggestions to ensure applicable stakeholders are involved, and considerations for jurisdictional evaluation programs and exercise priorities. Next slide, please. The 15 capabilities are listed here. Rather than describing all 15, I'd like to explain a few that best relate to how public health officials and schools can work together. We're going to focus on community preparedness, information sharing, medical material management and distribution, non-pharmaceutical interventions, and public health surveillance and epidemiological investigation. Next slide, please. So the first capability is community preparedness. For this, establishing and strengthening partnerships between education and public health officials is essential. Through engagement and coordination with the cross-section of state, local, tribal, and territorial partners and stakeholders, the public health role in community preparedness is to support the development and promote awareness of public health, healthcare, human services, mental and behavioral health, and environmental health systems that support community preparedness, participate in awareness training on how to prevent, respond to, and recover from incidents that adversely affect public health, to identify at-risk individuals with access and functional needs who may be disproportionately impacted by an incident or event, to engage in preparedness activities that address the access and functional needs of the whole community, as well as cultural, socioeconomic, and demographic factors, to convene or participate with community partners to identify and implement additional ways to strengthen community resilience, and to plan to address the health needs of populations that have been displaced because of incidents that have occurred in their own or distant communities, such as after a radiological or nuclear incident or a natural disaster. Public health officials should include education agency leaders in community preparedness efforts. Often it seems as though schools are thought of primarily for their buildings. Schools are often one of the few spaces in a community with the capacity to serve as shelters, triage sites, and community resource centers. However, health officials should not assume that a school has this capacity. Instead, they should ensure that planning efforts include how and when school buildings will be engaged in an emergency. These plans should recognize that schools are in loco parentis, serving as guardians when students are away from their parents. This means that preparedness exercises and planning activities should consider what will happen if an emergency occurs while students are at school. They should also recognize that the primary goal of schools is to educate students, and this should be their focus as much as possible. Next slide, please. Information sharing is the ability to conduct multi-jurisdictional and multidisciplinary exchange of health-related information and situational awareness data among federal, state, local, tribal, and territorial levels of government and the private sector. This capability includes the routine sharing of information and data, as well as issuing a public health alert to all levels of government and the private sector in preparation for and in response to events or incidents of public health significance. Almost every emergency has an impact on schools. It's important for public health officials and schools to regularly share relevant information with each other and to work together on risk communication messaging. Health officials should ensure that they're sharing public health alerts with schools, along with relevant information on what schools need to do to prepare and respond. Schools and public health can set up systems to share data, like they did during COVID-19, to share information on cases related to schools. During the past 2 years, CDC and the U.S. Department of Education worked together to gather information on school learning modalities, that is fully in-person, fully remote, or hybrid, and the implementation of various prevention strategies like masking requirements, and then publish these data on both the Health and Human Services, that's CDC's parent department, and the U.S. Department of Education website. Next slide, please. Medical material management and distribution is the ability to acquire, manage, transport, and track medical material during a public health incident or event, such as vaccines, gloves, and masks. During an incident, public health officials can work with schools to acquire and distribute materials as needed. During COVID-19, the U.S. government, as well as many health departments, supported the distribution of vaccines, tests, and masks to and through schools to the larger community. Next slide, please. Public health surveillance and epidemiological investigation is the ability to create, maintain, support, and strengthen routine surveillance and detection systems and epidemiological investigation processes. It also includes the ability to expand these systems and processes in response to incidents of public health significance. Public health officials should have routine surveillance and detection systems. They should work with schools to identify and investigate infectious disease outbreaks and should have the capacity to expand their support to respond to significant incidents. During COVID-19, CDC implemented this capability in collaboration with state and local public health departments and with schools and local education agencies by conducting investigations on outbreaks and the effectiveness of various COVID-19 prevention strategies. We worked together to learn about the ideal quarantine period length, to understand mask use in schools, and to investigate whether test to stay was a good alternative to quarantine for unvaccinated students, among other investigations that help schools keep more students safely in person. Next slide, please. The final capability I want to highlight is non-pharmaceutical interventions. Non-pharmaceutical interventions are actions that people and communities can take that don't involve medications to help slow the spread of illness or reduce the adverse impact of public health emergencies. This capability focuses on communities, community partners, and stakeholders recommending and implementing non-pharmaceutical interventions in response to the needs of an incident, event, or threat. Health officials can work with schools to provide information about non-pharmaceutical interventions. Health officials should also work with schools to identify ways that these interventions can be effectively implemented with minimal disruption to education. Many of these interventions are familiar to us after the COVID-19 pandemic, such as isolation, quarantine, restrictions on which businesses can be open, social distancing, and washing hands. During COVID-19 and monkeypox, CDC implemented this capability by providing guidance and technical assistance for schools about how to implement non-pharmaceutical interventions. Next slide, please. As we've seen from just these few capabilities, there are numerous ways for public health and education to work together before, during, and after emergencies. Before an emergency occurs, preparation is key to minimizing its effects. This is the case for both short and long-term emergencies. Public health officials and schools should work together to build and maintain partnerships with each other and other relevant organizations. As many health officials and schools have already built partnerships during the pandemic, they have a foundation for future preparedness efforts. These partnerships and regular communication serve as a foundation for positive interactions and rapid response. Schools and public health officials should work together to conduct exercises to practice their plans and identify gaps in their planning for both short and long-term emergencies. Once an emergency begins, public health officials should reach out to schools to identify their needs and provide information as needed. Public health officials should work with schools to provide information about ways to keep students and staff safe. These actions should balance health risks with the school's ability to implement the recommended interventions, their educational impact, and whether the interventions have equity concerns to consider. As an emergency wraps up, health officials and schools should work together to support the mental health needs of staff and students. Afterwards, health officials and schools can evaluate their response. This provides an opportunity to identify both what went well and areas of improvement. These can be used to share lessons learned with other communities and improve the plan to better prepare for the future. Next slide, please. Finally, in addition to the many resources from the REMS TA Center, CDC also offers a few relevant resources and trainings. Our colleagues at the REMS TA Center have added these to their resource list for this webinar. We're also working on new web content about how schools can prepare for emergencies, so please check back regularly for more information. Next slide, please. And actually, you can go to the next slide. So you can learn more about DASH, the Division of Adolescent and School Health, through our website and on Twitter. You can also email us at schoolpreparedness@cdc.gov or call CDC's General Information Line, which can provide answers to common questions and direct tough questions to the right team. Thank you. I'll turn it back over to you, Janelle.
Thank you so much, Lisa, for all of the great insight that you shared today. And for everyone, you can follow CDC DASH via Twitter as well as the REMS TA Center. Again, we will be hosting a Twitter chat directly following this event to continue the conversation a bit more. Also, the resources that Lisa shared via her presentation are also available for download via the web link, so don't forget to download them and share them with your colleagues as well. Now let's spend a little time walking through how public health officials can help enhance the six-step planning process for EOP development. As mentioned earlier, the most comprehensive and effective school EOP is developed by a multidisciplinary planning team, as Lisa just so eloquently described as well, and it really adds to the value, the breadth, the depth, and scope of the plan. Public health officials can support various aspects of EOP development as well as each phase of the emergency management process. A district core planning team may include local public health agency heads, managers, or senior staff, or even regional public health agency representatives or senior public health staff. Whereas the planning team at the school level may include program officials from those same local or regional public health agencies. The district should have policies and procedures on which community partners should be represented on the school core planning team, how community partners will be recruited, selected, and represented. They should help to establish formal agreements with those community partners and help look at and define a realistic level of participation by those community partners on those school core planning teams, as well as on those ad hoc planning teams. In step 2, the planning team identifies hazards and threats unique to the school community and then prioritizes them. Assessments are really important sources of information, such as culture and climate assessments, capacity, behavioral threats, and site assessments. Capacity assessments help the planning team understand, for example, what resources will be at its disposal in the event of an emergency. It examines the capabilities of students and staff, as well as the services and material resources of those community partners, including public health officials. This type of assessment is used to identify people in the building and within the school community with those applicable skills that will be needed before, during, and after an emergency. So in thinking about public health officials, the capacity assessment may determine the need to reach out to those partners to help with first aid certification, understanding of social distancing or quarantine requirements, in some cases, counseling and mental health expertise, an understanding of the equipment and supplies that should also be inventoried in thinking about medical needs, particularly to consider the ability to assist individuals with disabilities and other access and functional needs. For example, the inventory should include an evaluation of equipment and supplies uniquely for individuals with disabilities, such as evacuation chairs and consumable medical supplies and durable medical equipment that may be necessary during, for example, a shelter-in-place or an evacuation. So these are areas in which the school public health official will be quite helpful. In step 3, the team decides which threats and hazards will be addressed in the EOP and then develops goals and objectives for each. During this work, the team may identify cross-cutting functions and develop goals and objectives for each of them. And public health officials should participate in the development of those goals and objectives, especially those specific to public, medical, and mental health. And we are showing you a sample screen here that you can use as you collaborate with your community partners and think about some of those goals and really thinking about them from the context of the before, during, and after phases of an emergency and filling in the blanks and then integrating those into your EOP. And public health officials, remember, may also provide insight on infectious disease, of course, but also contaminated food outbreaks, natural hazards, hazardous materials releases, continuity of operations, recovery, response, and so much more. In step 4, the planning team builds upon those goals and objectives created in the previous step and assigns actual courses of action that address the who, the what, and the how for achieving those goals and objectives. Together, those form the annexes or portions of the emergency operations plan. And the public health official partners will be able to speak to the capacity and limitations of the local public health agency as those courses of action are developed. They may also be able to help identify strategies and or opportunities for sharing of resources between agencies and thinking about mutual aid agreements. In step 5, the team develops a basic plan of the school EOP, formats those annexes, and then reviews all sections. After the plan is approved by leadership, the team should securely share portions with community partners. And we say securely because it's important to work with legal counsel to determine who should receive access to particular portions of the EOP. Among other things, memoranda of understanding with public officials at the health level may provide clarifications around how those partners will support schools with ensuring compliance, for example, with legislatively mandated public health requirements, as we saw with the COVID-19 pandemic. The MOU may also address how schools should partner with public health officials to address some of the shifting public health guidelines created to protect the whole school community. And the district will provide key support in developing policies and procedures for which community partners will support the review and evaluation of the school emergency operations plan. Finally, the planning team needs to actually implement the EOP. And again, we saw that many of you who are joining today support EOP development, but also training and exercises. And step 6 is where those training and exercises take place. They provide an opportunity for the whole school community to actually practice the plan. To effectively execute an exercise, schools should truly work with those community partners who will be supporting response or recovery in the event of emergency. As members of the core planning team, public health officials will be able to contribute to revisions to and the overall maintenance of the EOP after an event, whether a real emergency or an exercise. So again, thinking about the COVID-19 pandemic, for example, required a lot of updates to school EOPs and collaboration with public health officials as those updates were made. And in some cases, again, that included some pivoting or shifting guidelines. And so those public health partner relationships are so important as schools ensure that they are protecting the whole school community. And really having those revisions take place is how the planning team can close the loop and ensure that the plan evolves to meet the needs of the school community. The district can develop policies and procedures, again, on which community partners will be available to or who should support particular types of exercises, whether functional, tabletop exercises, or actual drills. That may also include the involvement of community partners such as public health officials in professional development or training activities and thinking about efforts to clarify portions of the plan and their role in the plan. So all of those things will take place during step 6, and it's why all community partners should also have the most current version of the school EOP so that as those courses of action are practice, everyone is on the same page about their role and their responsibility in the plan. So thank you so much to everyone who has submitted questions for today's event. We will move into our Q&A session at this time. And Dr. Barrios, we have the first question here that I will pose to you, which is, how can I determine the best public health community partners in my state or my locality?
Sure. So, public health is a government resource, and so I would typically start local. And actually, I guess the question first would be whether or not it's coming from a school or a district. And I would definitely encourage, if this is the questioner is at the school level, that you work with your district, because most likely the school district has a relationship in one way or another with the local health department. Public health tends to be both state level and local, being either the county or city or equivalent in your community. I would go there and look for the emergency response office within that health department.
Thank you so much, Dr. Barrios. And I will also add that the REMCA Center has a state map of emergency management resources available via the resources tab on our website. You may also go there to access some of your state points of contact at the emergency management level, and they might be able to provide support to you as you look to identify some of those public health partners already supporting schools with emergency preparedness and safety within your state. I have another question here, Dr. Barrios. Are there any special considerations for schools as they develop memoranda of understanding with public health community partners?
Yeah, I think first thing I would keep in mind is that, as you were talking about, Chanel, an MOU is definitely important and useful, but keep in mind that it's a piece of paper. And while there's certain content that you want to make sure that you have in there, what's most important is that you keep it as a guidepost and as a sort of a living document to guide the relationship that you have with your colleagues at the health department. Having just an MOU and not actually maintaining those conversations, having regular meetings, exercising together, those are the sorts of things that are really going to make a difference. That said, when you're thinking about what's in your MOU, I would think about some of the things that I was talking about in terms of the various public health capacities. So, for example, what kind of preparedness activities might you do together? What kind of information sharing might be good to have set up in advance? So, for example, does it make sense to have any kind of regular data flow on something like absenteeism, for example, so that you have that ongoing relationship and ongoing sharing of information that you can then build upon when you're in a crisis situation. Think about what needs to happen before an emergency, what needs to happen during an emergency, how you're going to work together, how you're going to share information, what kinds of capacities the health department is going to be able to offer the school, what kind of things the school might be able to offer to the health department, and then thinking about afterwards what you're going to plan to do together in terms of after action, in terms of providing mental health support to staff and students, thinking about lessons learned together, and sort of revisiting your emergency operations plan and how that might need to change based on your joint experience.
Thank you so much, Dr. Barrios. And I will also add, for support, the REMCA Center recently released an online course on developing MOUs for enhancing emergency preparedness in the school setting. So we do encourage you to visit the trainings tab via our website and to select online courses from there, and you will see that resource as well as others. We also recently released a fact sheet on whole community planning and incorporating community events into EOPs and coordinating with partners. And I just wanted to mention that because I know that some emergencies that may involve the support of public health officials might be emergencies that are happening at the whole school community level. So again, that resource is available if you are in need of support. I have two additional questions here, Lisa, both related to COVID-19. The first one is regarding COVID-19 response. Verbiage in the guidance seems to provide differing options for the general public regarding what's required, what's recommended. Can you help clarify who must follow what laws and when?
Yeah, sure. I think the most important thing to point out is that CDC guidance is meant to supplement, not replace any federal, state, tribal, local, or territorial laws, rules, and regulations with which schools have to comply. So you always need to go with what is your state and local health and safety laws, rules, regulations. That's the most important thing. CDC guidance provides information based on science and best practice that can help schools understand what is most likely to be successful in helping to prevent disease and keep schools open. The other thing I just want to note is that the guidance is typically written to provide flexibility so schools can adapt to changing local situations, to their own local requirements, to periods when community health impact goes up or down. So our guidance is tied to higher COVID-19 community levels, medium community levels, and lower ones, and that allows some of that flexibility. So all of those things sort of work together, but I think the most important thing to keep in mind is that the laws and regulations that you are subject to from your state and local are what is primary here.
Thank you so much for clarifying that, Dr. Barrios. And the additional question is, has the role of public health officials in supporting school safety changed in response to the COVID-19 pandemic? And if so, can you describe how?
Yeah, I think it has changed quite a lot. I mentioned in my remarks that, often public health seem to think about, and local emergency management seem to think about schools in terms of the building and, how they might be able to make use of that building for triage or shelter. And one thing that I've seen come out of this response is to really think about the impact of an emergency on the students and staff and schools functioning. And the other piece of that is to really much larger, increased understanding of the impact of schools being open and students being present in person for the larger functioning of the community. Obviously we've seen this in when an entire community is affected by a natural disaster. But in this case, what we saw was schools shutting down and, in person at the beginning of the pandemic. And even though the disease itself was not having a very severe effect on young people, what we saw was a huge impact on economics, on parent and student well-being, of not being able to go to work, not being able to work fully, or not being able to provide to get childcare, and the impact on young people on their academic success, on their mental health, on their relationship with friends, and their even decreased physical activity. And so there's been a huge acknowledgement of the impact of an event like this on schools, and then the subsequent impact of the school not being able to be in person on the larger community. And so I think that is one huge lesson learned for public health, and there's definitely a much greater interest in engaging with school safety efforts more broadly coming out of this pandemic response. I also think that that there's been so much activity in terms of developing guidance for schools, developing and providing assistance with contact tracing, providing all sorts of resources to schools that I think is also something that public health is newly aware of the need for, and saw tremendous benefit from engaging with schools in this way throughout the pandemic. And so I also think that that's something we'll continue to see. Certainly seeing it in monkeypox as well. Definitely have heard from so many state and local health departments, looking for guidance and resources to share with their school colleagues about monkeypox. So it feels like it's something that is going to continue in terms of public health wanting to be there to be able to support schools in future public health related emergencies.
Thank you so much, Dr. Barrios, and thank you so much for all that you and your team do to support schools and school districts with these efforts. Thank you again to all of our participants for submitting questions. We do want to take a moment to just direct your attention again to some key resources that we've provided to support your work. And again, these are all available via the web link. Along with the resources that Lisa shared today, the REMCA Center has uploaded a few related fact sheets, one on pandemic planning and development of an infectious disease annex. We've also developed a infectious disease tabletop exercise within our emergency exercise package. And there is also within our specialized training package an infectious disease training module. So again, we encourage you to download those resources. We also have an online course on planning for infectious diseases and thinking about it specifically in the context of EOP development. We've also uploaded a fact sheet on ordering PPE for schools in efforts to keep the whole school community safe in school buildings. Again, something that is an important effort with which to collaborate with your community partners. Again, we also uploaded the Guide for Developing High-Quality School Emergency Operations Plans, which you heard a little bit about as we walked through the 6-step planning process. We've also uploaded the companion to the school guide, which takes a look at the role of districts in that high-quality school EOP development. Download, share, spread the word about the free resources that we provide here at the REMCA Center. as well as all of the ways that public health officials can support schools as community partners. Thank you again to Dr. Barrios for all that you shared today. We truly learned a lot here at the REMCA Center. And please remember that the REMCA Center is also a resource. We are only an email or phone call away. Please reach out to us if you have any technical assistance requests on any aspect of emergency management planning or EOP development. Again, we also encourage you to follow us on Twitter at REMCA Center, where we not only host web chats, such as the one that we will be hosting in just one moment, but we also share resources from the REMCA Center as well as our partners. So thank you again for attending today's webinar, submitting your questions, and engaging with us throughout the event. The REMCA Center appreciates your participation and hopes to see you again at another webinar in our series. We are hosting one coming up on September 13th on the role of school nutrition directors. We will now head over to Twitter to continue the conversation. Thank you again for joining us.